Good morning, everybody. This is Dr. Chehade coming to you from our Seaforth Oral Surgery Continuing Education Center. And I just thought I'd take a few minutes to add a little bit of coherence to some of the material that we posted last night on our Instagram and Facebook account regarding our suturing techniques in dentistry course that was held in our conference center right here. It was a very informative lecture provided by Dr. Chehade, who in a very talented way crystallized the pertinent details related to suturing techniques and materials and instrumentation that are used in dentistry and oral surgery, and shared it with a group of dental clinicians here in our CE Center. And it was followed up by a hands-on technique course using, believe it or not, bananas with incisions in them to talk about suturing techniques, correct suturing techniques with various materials and instruments. We use dentiform models to illustrate different dental scenarios for exodontia, socket grafting scenarios or ridge preservation scenarios, as well as surgical approaches to aesthetic regions of the mouth for implant surgery. I thought I'd just take a few minutes to talk about why we put on these courses. Our goal at Seaforth Oral Surgery, and one of the things that's part of the fabric or culture of what we do, is teaching. Dr. Chehade and I have a long history of teaching at the McGill University Health Center, where we've been involved with training oral surgery residents and dental residents, as well as dental students in oral surgery and dentistry over the past for a combined total of probably close to 20 years. And so teaching is a big part of what we do. It's what we enjoy doing. Sharing your knowledge is a very gratifying thing to do. And last night was a great example of that. We really enjoy reaching out and connecting with the dental community, sharing our knowledge in things that we do on a day-to-day practice with clinicians. Establishing communication channels with dentists and their teams is something that we depend upon, quite frankly, and we want people to know that we're here and available to share our knowledge. We also want people to know that we're here and available to receive their patients, and we're available to take excellent care of them. But that being said, our CE curriculum really has a goal of elevating the knowledge and of the dentists that work around us, as well as adding a certain element of gratification to them and their dental teams, and having them learn a bit more about what it is that they can offer their patients either in their offices or through our services. And so last night was a really successful event. You saw some of the photos that were posted of in addition to a video that was posted en français regarding some of the hands-on exercises that we did. And just to review very quickly, what we did last night was, in case you're interested one day, we talked about suturing techniques in basic surgical knot application and different techniques of interrupted sutures versus continuous sutures and continuous interlocking sutures. On the dentiform models, we reviewed socket preservation techniques with materials such as BioOS and BioGuide and PTFE sutures. We also talked about surgical access to the alveolus for different implant surgical scenarios or different reconstructive surgical scenarios for bone grafting. I thought it was a very effective exercise, judging from the reaction and the questions from the audience, and we feel that it was really well received. So we do appreciate all the attention that it received on Facebook and on our social media. And I just thought I'd take a few minutes this morning to elaborate on what those videos were about. One of the questions that came up last night was about our course curriculum that's coming up shortly on the dental implant boot camp that's being offered over a course of 5 evenings between February 9th and May 10th. And this is an overview of dental implantology, or rather dental implant rehabilitation, that's aimed at dentists that wish to have an overview of the subjects of dental implant rehabilitation. It's not meant to be an in-depth course that would allow an individual to then proceed to place implants. The next course that we're offering, in comparison, just to clarify, is the fundamentals of surgical implant placement that you can see at our website or on these flyers here. And the fundamentals course is one that's a 15-hour training course that's meant to provide an in-depth training in the various treatment indications for implant rehabilitation, various bone grafting techniques from minor to major bone grafting techniques, as well as a review of surgical navigation techniques that allows a much more fundamental and in-depth approach to implant surgery. That course is meant to meet the ODQ training requirements of 15 hours for dentists that wish to obtain those continuing education criteria according to the ODQ guidelines for trainings in implant rehabilitation. So I appreciate you listening. I'm coming to you here from our continuing education facility, which is a really nice room. Has a capacity to hold about 50 people, and we really enjoy teaching here. It's a lot of fun, and so I would encourage you to join us at one of our events. If you have any questions about particular patients or continuing education topics that you'd like to hear about, we certainly welcome your feedback, and we thank you for listening to me. Have a great day.